Hey there, future medical experts. Ever wondered about the mysterious bone that lies right between your eyes? It's small, delicate, and incredibly vital. Today, we're diving deep into the world of the ethmoid bone. Whether you're a medical student, a curious learner, or just someone fascinated by the human body, this video is for you. Stick around, because we've got some mind-blowing facts and essential knowledge coming your way. Let's kick things off with the basics. The ethmoid bone is nestled right here, at the base of your skull, between your eyes. It's a critical component of both your skeletal and nervous systems. Quick facts. Location: viscerocranium. Bone type: irregular bone. Articulates with: frontal bone, sphenoid bone, palatine bone, lacrimal bone, nasal bones, maxillae, inferior nasal conchae, and vomer. Arterial supply: anterior and posterior ethmoidal arteries, and sphenopalatine arteries. Key features and anatomical relations. The ethmoid bone is a single, small, cube-like bone that is located centrally within the cranium. It is classified as an irregular bone. The cribriform plate is the only part of the ethmoid bone that contributes to the formation of the neurocranium, while the rest of the bone contributes to the formation of the viscerocranium. The ethmoid bone consists of ethmoidal air cells. Location of ethmoid bone. The ethmoid bone is located anterior to the sphenoid bone, posterior to the nasal and lacrimal bones, superior to the palatine bones, maxillae, vomer, and inferior nasal conchae, inferior to the frontal bone. It articulates with the sphenoid bone, lacrimal bones, palatine bones, maxillae, frontal bone, inferior nasal conchae, nasal bones, vomer. Ossification. Ossification of the ethmoid bone occurs at 3 ossification centers. These are found in the right and left ethmoidal labyrinths, with 1 center found in each, which appear in utero during the 4th to 5th months. Perpendicular plate, which appears during the 1st year after birth. The ossification centers for the ethmoidal labyrinths and perpendicular plate fuse with each during the 2nd year. Variations. In some individuals, the crista galli may be present in a pneumatized form, that is, contain air-filled cavities. The superior nasal conchae may be present in a pneumatized form. Accessory ethmoidal foramina may be present. Parts of ethmoid bone. 1. The cribriform plate, or what we call horizontal plate, is the horizontal, sieve-like plate of bone found along the superior aspect of the ethmoid bone. The cribriform plate consists of many cribriform foramina, which allow for the passage of the olfactory nerves. Consists of 2 anteriorly located grooves that lodge the olfactory bulbs. Contributes to the formation of the anterior cranial fossa and the roofs of the nasal cavities. 2. The crista galli is the thick, triangular, superiorly projecting process found along the midline on the superior aspect of the ethmoid bone. It is continuous inframedially with the perpendicular plate and continuous infralaterally with the cribriform plate. The crista galli consists of right and left alae, provides an attachment site for the falx cerebri, articulates with the inframedial aspect of the frontal bone, contributing to the formation of the frontoethmoidal suture. contributes to the formation of the foramen cecum and anterior cranial fossa. 3. The ethmoidal labyrinths or the lateral masses are the two irregular, laterally located, bony masses of the ethmoid bone. On its corresponding side, each ethmoidal labyrinth consists of an orbital plate, uncinate process, ethmoidal air cells, superior and middle nasal conchae, and anterior and posterior ethmoidal grooves. Contributes to the formation of the lateral wall of a nasal cavity and the medial wall of an orbit. Articulates with the maxilla, inferior nasal concha, frontal, lacrimal, palatine, and sphenoid bones. 4. The perpendicular plate, or the perpendicular part, is the vertical, flat, inferiorly projecting bony plate found along the midline on the ethmoid bone. It is continuous supromedially with the crista galli and continuous supralaterally with the cribriform plate. The perpendicular plate consists of anterior, posterior, and inferior borders and right and left lateral surfaces. Contributes to the formation of the nasal septum. Provides an attachment site for the septal nasal cartilage. Articulates with the vomer, frontal, and sphenoid bones. 5. The anterior ethmoidal foramen, or the anterior ethmoidal canal, is a small anteriorly located opening found along the junction between the frontal and ethmoid bones. Each anterior ethmoidal foramen is located lateral to the cribriform foramina and anterior to a posterior ethmoidal foramen. The anterior ethmoidal foramen allows for the passage of an anterior ethmoidal artery, vein, and nerve. 6. The foramen cecum is a small opening found along the anteromedial area of the anterior cranial fossa. The margin of the foramen cecum is formed anteriorly by the frontal crest of frontal bone, posteriorly by the allay of crista galli of the ethmoid bone. During fetal development, the foramen cecum allows for the passage of a vein from the nasal cavity to the superior sagittal sinus, which may continue to be present in some adults. 7. The posterior ethmoidal foramen, also called posterior ethmoidal canal, is a small, posteriorly located opening found along the junction between the frontal and ethmoid bones. Specifically, it is situated lateral to the cribriform foramina and posterior to the anterior ethmoidal foramen. The posterior ethmoidal foramen allows for the passage of a posterior ethmoidal artery, vein, and nerve. Surfaces of ethmoid bone. 1. The anterior border, or the anterior margin, is the thin, oblique, frontal margin of the perpendicular plate of ethmoid bone. It articulates with the infromedial aspect of the frontal bone, contributing to the formation of the frontoethmoidal suture. 2. The inferior border, or the inferior margin, is the long lower margin of the perpendicular plate of ethmoid bone. Its anterior portion provides an attachment site for the septal nasal cartilage, while its posterior portion articulates with the anterior border of vomer. 3. The lateral surfaces are the two flat, mostly smooth areas found on both the right and left aspects of the perpendicular plate of ethmoid bone. Each lateral surface is bounded by the anterior, posterior, and inferior borders of the perpendicular plate of ethmoid bone. Contributes to the formation of the medial wall of the nasal cavity on its corresponding side. 4. The orbital plate, lamina papyracea, is the thin, smooth area found along the supralateral aspect of the ethmoidal labyrinth. It contributes to the formation of the medial wall of the orbit and articulates anteriorly with the posterior border of lacrimal bone, forming the ethmoidolacrimal suture, posteriorly with the anterior surface of the body of sphenoid bone, contributing to the formation of the sphenoethmoidal suture. superiorly with the inframedial aspect of the frontal bone, contributing to the formation of the frontoethmoidal suture. Antero-inferiorly with the orbital surface of the maxilla, forming the ethmoidomaxillary suture. Postero-inferiorly with the orbital process of palatine bone, forming the palatoethmoidal suture. 5. The posterior border, or the posterior margin, is the thin vertical, dorsal margin of the perpendicular plate of ethmoid bone. It articulates with the anterior surface of the body of sphenoid bone, contributing the formation of the sphenoethmoidal suture. Landmarks of ethmoid bone. 1. The alae are the two wing-like, lateral projections that form the anterior aspect of the crista galli of ethmoid bone. They form the posterior margin of the foramen cecum and articulate with the inframedial aspect of the frontal bone, contributing to the formation of the frontoethmoidal suture. 2. The anterior ethmoidal grooves, anterior ethmoidal sulci, are the two small horizontal, anteriorly located depressions found along the supralateral aspects of each ethmoidal labyrinth. On its corresponding side, each anterior ethmoidal groove of ethmoid bone travels laterally from the anterior cranial fossa to an orbital cavity, is converted into an anterior ethmoidal foramen anterior ethmoidal canal by its combination with an anterior ethmoidal groove of frontal bone, and this foramen allows for the passage of an anterior ethmoidal nerve and vessels. 3. The middle nasal conchae, middle nasal turbinates are the two curved, antero-inferiorly located, bony plates found along the medial aspects of each of the ethmoidal labyrinths. On its corresponding side, each middle nasal concha is located inferior to a superior nasal concha, forms the floor of a superior nasal meatus and the roof of a middle nasal meatus, contributes to the formation of the lateral wall of a nasal cavity. 4. The superior nasal conchae, or the superior nasal turbinates, are the two curved, postero-superiorly located, bony plates found along the medial aspects of each of the ethmoidal labyrinths. On its corresponding side, each superior nasal concha is located superior to a middle nasal concha, forms the roof of a superior nasal meatus, contributes to the formation of the lateral wall of a nasal cavity. 5. The posterior ethmoidal grooves, posterior ethmoidal sulci, are the two small horizontal, posteriorly located depressions found along the supralateral aspects of each ethmoidal labyrinth. On its corresponding side, each posterior ethmoidal groove of ethmoid bone travels laterally from the anterior cranial fossa to an orbital cavity, is converted into a posterior ethmoidal foramen posterior ethmoidal canal by its combination with a posterior ethmoidal groove of frontal bone, and this foramen allows for the passage of a posterior ethmoidal nerve and vessels. 6. The uncinate processes are the two curved, hook-like projections found along the infralateral aspects of each of the ethmoidal labyrinths. On its corresponding side, each uncinate process articulates with the ethmoidal process of an inferior nasal concha. Sutures of ethmoid bone. 1. The ethmoidolacrimal suture, or the lacrimoethmoidal suture, is a fibrous joint found along the orbit of the cranium. It is the articulation site located between the orbital plate of the ethmoid bone and the posterior border of the lacrimal bone. 2. The ethmoidomaxillary suture, or the maxilloethmoidal suture, is a fibrous joint found along the orbit of the cranium. It is the articulation site located between the orbital plate of the ethmoid bone and the orbital surface of the maxilla. 3. The frontoethmoidal suture is a fibrous joint of the cranium. It is the articulation site located between the inframedial aspect of the frontal bone and the superior aspect of the ethmoid bone. 4. The palato-ethmoidal suture is a fibrous joint found along the medial bony wall of the orbit. It is the articulation site located between the orbital process of the palatine bone and the orbital plate of the ethmoid bone. 5. The spheno-ethmoidal suture is a fibrous joint of the cranium. It is the articulation site located between the anterior surface of the body of sphenoid bone and the posterior aspect of the ethmoid bone. The spheno-ethmoidal suture is present in adults and replaces the spheno-ethmoidal synchondrosis during development. Here are some fun facts about the ethmoid bone. Did you know that it's one of the most complex bones in the human body, despite its small size? And it's the only bone in the skull that is largely made up of air-filled spaces. The spheno-ethmoidal suture is present in adults and replaces the spheno-ethmoidal synchondrosis during development. Isn't the ethmoid bone fascinating? From supporting our senses to playing a crucial role in our respiratory system, it's an unsung hero of our anatomy. If you found this video informative and engaging, don't forget to hit the like button and subscribe to our channel for more deep dives into the wonders of the human body. And if you have any questions or topics you'd like us to cover, drop a comment below. Stay curious and keep exploring.